Testosterone, take two. Why do you need to balance your testosterone? I'm doing this video again because the first one was not clear. What is low testosterone? This is when you have either hypogonadism or andropause, meaning you just don't have enough testosterone hormone. The benefits of having balanced testosterone, first of all, in your teen years, it's to develop your male reproductive tissues. Later on in life, we need it for our cardiovascular health. So especially for men, to lower the LDL and to increase the HDL. So these are the two cholesterols that we know of. Insulin sensitivity, because this reduces the risk for metabolic diseases such as diabetes, even pre-diabetes, and not gain weight, especially around the waist. It also increases muscle mass and also helps maintain what you have. Libido, that's self-explanatory. It also increases cardiac contractions. This is how strong your heart actually contracts to pump out blood into your arteries, okay, and circulate all over your body. It also has an anti-inflammatory effect. Testosterone targets organs. As you can see here, the skin, the brain, the liver, muscle, kidneys, the organs, male organs, bone marrow, so it helps with growth, all kinds of things, as you can see in this diagram right here. What are the symptoms of low testosterone? A, low sex drive. Number 2, increase in belly fat, which is also a sign of insulin resistance, which is a metabolic condition. Sluggishness, having low energy, both physically and mentally, also called brain fog. Increased coronary artery or calcium scores. So this is when you see the accumulation of cholesterol accumulated in the arteries, which is not a good thing. Increase in fasting blood sugars or hemoglobin A1C, again, insulin resistance, pre-diabetes, that kind of thing. And then a depressive or grumpy mood and lack of motivation. What causes low testosterone? Number 1, simple aging. As you get older, it drops. Second, chronic or emotional and physical stress, meaning if for a long time, having stress or eustress is normal to live, but when it's chronic and it's extended and for a long time, it can cause low testosterone levels. High carb diet, especially processed food, will cause a low testosterone. Low vitamin D, low zinc, that does cause low testosterone. And finally, not saying that you should quit these medications if you're on them, but they do cause low testosterone. Statins, which is your cholesterol medications. Narcotics, which is mainly your pain medications. And then what we call SSRIs or antidepressants. Just factor in, if you're on these medications, that this is a side effect of them as well. How do we diagnose low testosterone? The most efficient way, first of all, is a questionnaire. So, because a lot of times patients have the symptoms but don't know that they are related to low testosterone. So a really good questionnaire for every male patient, especially anyone over 40, is important at the doctor's office. And number 2, lab work. And what labs are we talking about? Free and total testosterone, SHBH, PSA, because you want to keep an eye on that prostate. Estradiol, yes, it's a female hormone, but if it's elevated over 35 in men, it can counter testosterone. Again, vitamin D. A full thyroid panel, that is imperative, especially not just TSH, you need to check like the free T3 especially. Prolactin, that's just a lab that tells us that this little thing in the brain is not causing a problem with your hormones, so it's just a check system. And then again, the hemoglobin A1C and fasting insulin, you gotta keep an eye on the blood sugars, okay? So what are we looking for? Just at a glance, make sure your testosterone levels, okay, your total testosterone is at least over 500, because that is where the cardiovascular benefits of testosterone start. So at a minimum, it needs to be that number. If it's not, speak with your doctor about that. If your doctor, some doctors are not comfortable treating this, seek one that can, okay? Also, estradiol, make sure, again, it's a female hormone, I know. In men, it needs to be under 35. Higher than that has symptoms, okay? Vitamin D needs to be about 50 nanograms per DL, because among other benefits of vitamin D, it is a pro-hormone. So if it's standing on its square, hormones tend to work better. How do we treat low testosterone? The common one that everybody knows is this intramuscular injections, usually once a week, prescribed by a doctor. Also, we have gels or compounded creams, right? So the gels come from your regular pharmacy, again, prescription, or creams are compounded in a compounding pharmacy, which means they're kind of catered to your particular need and how low your level was. We have implantable pellets. These also are dose-based. These are placed in a male's either flank or behind once every maybe 5 to 6 months. It's a minor surgical office procedure. And that gives you this set it and forget it deal with testosterone for about 6 months. It's a depot system. And finally, for young men or males that still want to father children, they can get on HCG versus the testosterone hormone itself, because HCG preserves their sperm count. Supplements that help with your testosterone: vitamin D3 plus K2 for sure, zinc at least 20 milligrams, and then DHEA between 25 and 50 milligrams orally a day. What are the risks for treating testosterone? You can get an enlarged prostate, so this is why we need to watch your PSA levels. Gynecomastia, which is enlargement of breast tissue on a male, not desirable. There's a supplement called DIM, and you can take about 100 to 150 a day. It helps your body get rid of estrogen metabolites in your body, because there's a way the body can convert some of that testosterone to estrogen, and you need to get rid of it. Erythrocytosis, which is an increase in your red blood cells. The way to do this is A, maybe reduce your testosterone dose. B, donate blood regularly, okay? And to the extent that you do that, your physician would let you know. There can be a decreased sperm count, okay? For males that are not trying to father children, this is not an issue. But if you're trying to father children, you may have to get off your testosterone treatment. So follow-up care with testosterone hormone replacement therapy, my recommendation is, especially the first year, check your labs every 3 to 6 months so you can keep an eye on these concerns, and also to make sure that the level is therapeutic. And then after that, every 6 months to a year for sure, check it. All right, that's it. That's all. Thank you. See you on the next one.